I'm Dr. Frush. I'm a medical consultant working here today with the Contrast Creative team. It probably seems intuitive when we talk about keeping patients safe. I think that's what many people assume when they come to the hospital. But the reality is that we work in a very complex environment. It's actually very easy as a human being to make a mistake. And we as healthcare providers, as physicians, as nurses, can make mistakes. We make fewer mistakes and we can do a much better job if we work together as a team. And if we want to be a high-performing team, everyone on that team needs to speak up. Everyone needs to contribute to our work, and so that's what we're talking about today. Contrast Creative has done a lot of work with AHRQ, the Agency for Healthcare Research and Quality. AHRQ has provided funding for organizations like HRET to lead these patient safety projects, like Team Steps. Team Steps is a national program that provides education for healthcare providers to learn about the tools that we need to work as high-performing teams. It's a curriculum that's taught nationwide, and there's now evidence to show that providers who learn teamwork, who do teamwork training, develop the knowledge and skills they need to make care safer. There are other projects like SUS or CAUTI, ways again to make certain parts of healthcare even safer. CAUTI, as an example, a project that's focused on decreasing the risk of infection. SUS, a project that's focused on making surgical care safer. It's a patient safety project where we're really trying to create a real scene in the OR and help everyone understand what things we can do to keep patients safe. In working with Contrast Creative as a medical consultant, I've had the chance to work with colleagues across the country in creating scenarios that the Contrast Creative team turns into scripts and then hire actors and actresses to come in to bring those scripts to life. The scripts are very realistic, are very meaningful to healthcare providers. When we did this production today, where the surgeon stopped before the surgery started and went around the room and asked every person on the team to introduce himself or herself. That's something that's recommended on the surgery checklist. To just take a pause in the flow of what's going on, introduce yourselves. That little act of each person speaking up on the team to introduce themselves goes a long way in breaking down some barriers we have in healthcare. We work in this environment of hierarchy. Physicians are trained to be the leaders, and sometimes people on the team are actually kind of afraid of the physician, afraid of making the physician mad. They don't want to upset the surgeon. And some member of the team might actually see something that could cause a problem for a patient, and in the past be afraid to speak up, even when it's something that could lead to harm for the patient. And this checklist is a tool that helps everyone on that team have the courage and understand the responsibility that each of us have to speak up, to make it a safer place for patients to be. I work as an emergency physician. I love taking care of patients in the emergency department. I love working with the team. When I can also work with another team, when I can work with the Contrast team and work with colleagues to create scripts that come to life, and I know that those messages can get to thousands of other people with knowledge and tools that I know work because I use them in my own work. It's very gratifying to know. As I watch these actors and actresses saying their lines, using these tools, I imagine myself as that patient. Healthcare providers are really beginning to understand the power of these types of courses and these types of projects in helping them do what they want to do, which is provide the best possible care to patients, to make it safer.